A study conducted by Laboratory Studies of Respiratory Droplets was done, where using a high-speed video found that hundreds of droplets ranging from 20 to 500 micrometers was generated while saying a simple phrase, though nearly all droplets were blocked when the mouth was covered with a damp cloth. This is by at UCSF 2020. What does this mean exactly? It means that regardless of science behind wearing a mask during COVID-19 pandemic, while there's plenty of that to discuss, it's easy to see based on the study that we spill out hundreds of germs while in proximity with others. Medical experts say that we should all continue to wear masks, though the majority of the people are vaccinated. Steinberg at AZ Central 2021. While this pandemic affects you, it also clearly affects those around you. Since day one, we've all been just as susceptible as our neighbors, some more, to getting the virus. It affects all of us one way or another and has shown to literally be a life or death situation. If you feel as though you're not a part of the pandemic, I'm here to show you why you are. By continuing to wear a mask, you're contributing to the factor of this state collectively overcoming COVID-19. And by doing so, we are all a factor in our country overcoming the pandemic as well. Through listening to this speech, you will learn why it's so important to continue to wear a mask in public regardless of legal guidelines. My family were among some of those back in December of 2020 thought we could get into groups larger than 10 and have a big Christmas Eve, New Year's celebration. We believe that regardless of what state officials and science experts were saying, we'd be okay and not risk getting COVID-19. We were wrong. My entire family, including myself, became very ill and tested positive for the virus. If we were going to get back together, we should have all kept it in smaller units and wore masks around each other. Although Doug Ducey has listed the statewide mask mandate, excluding private businesses and government buildings, we should all individually make ourselves responsible for wearing a mask, as it collectively will help our country overcome the virus. By continuing to wear a mask in public settings, you will keep yourself safe, keep others safe, and help contribute to finally overcoming this pandemic through vaccinations. Wearing a mask creates a barrier between your mouth and your nose and also those around you. So let's further discuss how wearing a mask will protect you. When you wear a mask, you are actively choosing to protect yourself from retrieving another person's droplets. The amount of virus you're exposed to influences the risk of getting infected and also dictates how severe the illness will be. Dr. God, a physician at the University of California, said that if particles do somehow breach a mask, depending on how properly the mask fits, the disease, if caught, is much milder than without a mask. This is Wu from New York Times 2020. One of the most well-known studies was conducted by the World Health Organization, where they actually compared infection rates between mask wearers and non-mask wearers and found that mask wearers reduced their chances of getting the virus by more than 80%. McCarthy of Children's Hospital 2020. We all know that when we sneeze, sneezing into our inner elbows helps keep the droplets contained to us. Wearing a mask is very similar and even more effective, as it's a physical boundary between you and another containing our most vulnerable openings to our respiratory system. The task is simple and is a two-way street. To start off, let's remember we are all at risk of getting COVID-19. So in short, we need to remember even now we have not broken away from the virus, which means we are all still affected and we are all still in this together. As decent members of society, we must consider and prioritize the risk we could get, in fact, by carriers for the virus and not get ill or show any symptoms. A study was done, published in American Medical Society, where the team was comparing those who were asymptomatic and pre-symptomatic. They found that 30% of people with COVID-19 show absolutely no symptoms. Hartford Healthcare 2020. Researchers have noted that prevention is most effective when it's in a communal effort. The CDC has noted in several articles throughout this past year that if anyone wears a mask, or even 95% of the public does, in congregate settings, the risk of exposure can be significantly reduced, and we will really start to move beyond this virus. It's called source control. And it's pretty simple in regards to following and acknowledging. Dr. Fauci, the nation's top infectious disease doctor, he answers the question weekly of when will things be back to normal. And he must reply he doesn't know, but he does confidently know that it's highly dependent upon the basis of people wearing a mask still. Thebault, The Washington Post, 2021. Wearing a mask to protect others is, as many see it, the mask's most important use for society. If we collectively can lower the chance of another person getting affected by the transmitter of the virus, the impact will be highly significant and further help us in ending the virus. Wearing a mask to protect others is so selfless and so simple at the same time. According to Dr. Brooke and Butler from JAMA Insights, when Arizona had its mask mandate as a majority of the population was forced to wear masks in public domain, our state had, as they noted, a strong association between institute of wearing a mask and seeing decline in the new diagnosis. Brooks, MD, and Butler, MD, in JN 2021. This shows that collectively wearing a mask makes a significant difference in cases. On the opposite side, however, more and more people are getting vaccinated. As of the 16th of April, nearly 40% of Arizonians had their vaccines. Doug Ducey, in the past 2 weeks, has lifted the legality aspect of wearing masks. Arizona cases are also continuing to drop as of the 15th of April. Arizona is now at 18% of the cases dropped. We must also consider the science behind those who have already gotten the virus and survived. Dr. Stovall, Infection Prevention Medical Director with Lee Health, says patients can become reinfected within 4.5 months. This has proven to be a weight lifted off people's shoulders once they've had the virus. They know that they won't get sick again for quite some time, and therefore they feel safe and confident in not wearing a mask in public. Citizens also have a right to feel more form of a control within themselves. A lot of adults also feel uncomfortable conforming to something they may not understand or personally see enough evidence back behind the subject. Not wearing a mask is also a form of self-expression for many people. They feel by not conforming to society's standards of COVID-19, they are being left still in control of their own health and life. Dr. Seid, a psychologist from New York, says that at this point in the pandemic, people continue to feel more and more comfortable to make their own choices. Gillespie from Health.com, 2021. Now that you've heard the ugly truth behind what not wearing a mask will do for not only yourself but our state and country, I hope you'll agree to continue wearing a mask in public domain. We must remember that this affects all of us, no matter the circumstance, so we all need to be team players when it comes to covering up for our own well-being, but considerably other beings. Finally, as I'm sure you've all received the message, please consider why I've argued to wear a mask and just decided to do so today. Thank you for listening. I hope everyone found this information important and urgent. Have a good rest of your day.